And we are getting a new pulse of the American people with some new Ipsos polling. We're talking everything from healthcare to GLP-1s. Joining the conversation now is Mallory Newall from Ipsos, longtime friend of the ARC show. And Mallory, welcome as always. First of all, we always like to ask, what was the biggest surprise to you from this latest survey?
Hi, Patrick. Thanks for having me this morning. I think the biggest surprise may not even be a surprise. It's just how prevalent economic concerns are. And it really kind of runs across the gamut, whether you're talking about healthcare, whether you're talking about cost of living. I think the economy is just really front and center as we head into the midterm elections.
Okay, well, healthcare, of course, healthcare costs specifically appear to be a top concern for Americans. It typically is. So how much could that issue, of course, influence the midterms?
Well, I think that as long as political candidates are going to be able to connect the dots for voters that healthcare is, in fact, a pocketbook issue, that's really what's going to make the difference, because we know that the single biggest issue for Americans right now is the cost of living, is the economy. So our polling shows that policies that are aimed at lowering healthcare costs, like allowing Americans to buy prescription drugs directly from the manufacturers, those are really popular with a widespread majority of Americans.
In your poll, Mallory, also finding bipartisan support for some healthcare policies, but divisions on others, which is no surprise these days. But, you know, where did you see the greatest areas of agreement, which is always great to see, and where did you see the biggest divides?
Sure. So the biggest area of agreement is what I just mentioned, a proposal to allow prescription drug manufacturers to sell prescriptions directly to patients in order to reduce costs. Democrats, Republicans, independents alike broadly support that. Other things have more divisions, such as reinstating the subsidies for Americans to get insurance through the Affordable Care Act exchanges to bring those costs down. As well as the recent Supreme Court decision to allow mifepristone, a drug commonly used in medication abortion, through the mail and telehealth. Those are two more divisive policies.
Mallory, the poll also looking at Americans' views on GLP-1 weight loss drugs. I don't know a ton about these drugs. A lot of people don't. I know I'm not alone, but, especially those that are using these prescription drugs. So that's important to know more. So what did you learn about how much people either know or don't know about these medications?
Yeah, I mean, you're not alone, right? There's actually a large number of Americans that still are pretty unaware of what GLP-1s can do. While at the same time, we're seeing that the percentage of Americans that have ever used or know someone who's used continues to climb. It's at a high watermark right now. But right now, many Americans are unsure about the long-term health effects of GLP-1s, and interest is a little bit mixed. And I think that corresponds with this low awareness of what these weight loss drugs can do for people.
Did you see any notable differences by age or even it can be a political party or a region in the country as far as how people view this particular issue with GLP-1s?
With GLP-1s, and I guess this wasn't really surprising to me, maybe it makes sense to you as well, but the biggest difference is by gender. So women are significantly more likely than men to report having used a prescription weight loss drug at some point. And interest in using GLP-1s is a little bit higher among women than men as well.
Okay, now switching gears, Mallory, another hot topic issue here. What was the biggest takeaway from your polling, your latest survey on birthright citizenship?
Certainly a hot button issue right now. As you may know, the Supreme Court recently struck down the order that limits birthright citizenship. And that puts the Supreme Court in line with the American public. Most Americans oppose ending birthright citizenship, is what our polling shows.
Okay, and so how divided, so most supported as far as ending it, but how divided are Americans on birthright citizenship, and were you surprised by any of those results?
Yeah, and I know that's a little confusing, right? So oppose ending birthright citizenship means that you support keeping it in place. It is a constitutional right. This has become, over time, it wasn't always, if you look back to the mid 90s or so, but this has become an increasingly politically polarized thing the vast majority of Democrats, roughly 7 in 10, oppose ending birthright citizenship. They're joined by most independents. However, you get about 4 in 10 Republicans that want to protect birthright citizenship. So even this among President Trump's base is not necessarily a slam dunk issue, as Republicans are a little divided as well, which is surprising to me.
That is surprising, and I asked you this a moment ago as far as age and political party. You just answered that, but as far as the regions in the country, anything you can tell me there as far as what part of the country and how they view birthright citizenship?
Yeah, that's a good question. I would say that regional differences aren't super pronounced unless you're talking about people that live in urban areas versus people that live in rural areas, for example. But I think, frankly, that's kind of a proxy for partisanship. Among Republicans, I talked a little bit about that division that exists. And really, it comes down to a couple things. Those that identify as part of the Make America Great Again movement versus Republicans who don't identify as MAGA Republicans, that's certainly one. Younger Republicans are also more in favor of keeping birthright citizenship, and Hispanic Republicans as well. Other polling shows, which is a small but growing sect of the Republican Party.
All right, it's an important survey. It's a lot to break down. Mallory, as always, thank you for doing it. Thank you.
Thanks for having me.
All right.